hydroxychloroquine.
You'd never heard of hydroxychloroquine before we mentioned it.
I believe our focus on this drug has led directly to FDA emergency approval, which may save many lives, Tucker.
Chloroquine? Talk to me.
We're talking about hydroxychloroquine.
Hydroxychloroquine.
Hydroxychloroquine. Chloroquine.
Hydroxychloroquine.
Hydroxychloroquine.
Hydroxychloroquine. The one drug that's gotten mind share of the physician community, and I know this because I've spoken to so many doctors in so many states, is the chloroquine, hydroxychloroquine.
I'm not a doctor, and I will not play one on TV. But you keep hearing about chloroquine phosphate.
I think we should let doctors decide whether we should use hydrochloroquine.
Mr. Vice President, I'm holding up a letter, and I'm going to read from it in a second, from a doctor in the New York area. And he has a regimen, hydroxychloroquine.
If the chloroquine is effective, you might try it.
Hydroxychloroquine is an important weapon in our arsenal.
I'm not a doctor. I'm not going to play one on TV, but hydrochloroquine. My advice is if you think you or somebody you know has it or might be at risk of it, try and get chloroquine.
In a lot of ways, hydroxychloroquine is the ideal medicine.
I mean, Steve, this could be a game changer.
At this point, it's come across as pretty much of a game changer.
Yeah, and Dr. Oz has been putting on doctors that have been prescribing off-use hydrochloroquine and Zithromax, and patients that used it, miraculous turnarounds. If you had this virus, would you use them if you had the choice? Somebody says, hey, you might want to try this. I know I would try it. I would use it for me, and I'm only speaking for me.
Dr. Hannity, for Dr. Hannity, I'm my only patient. I would absolutely use it if I got this.
We have a lot of anecdotal evidence.
Tell us about what happened and what happened then after the hydroxychloroquine and Z-Pak.
A man in Florida, though, credits the drug with saving his life.
He thought he was at death's door. Then his doctors put him on hydroxychloroquine.
I had 2 calls to my radio show, said that young kids used it. The effectiveness was dramatic. Not for this, but for what underlying other issues.
Hydroxychloroquine seems to be the #1 choice of doctors around the world.
Threatening doctors who prescribe the drug without administration action. Oh, yeah, no, it's showing great hope now. If you just listen to me first and never listen to them, I think you'd be better off. They lie.
If hydrochloroquine has side effects, none of which are death, by the way.
Have you seen any side effects or any instances where it has not worked?
I've not seen big side effects. No one's complained about anything meaningful.
Dr. Siegel, is it the answer for a lot of people?
At the very least, we should all be following developments in hydroxychloroquine's use with interest and measured hope. Why wouldn't we be?
Dr. Fauci, when I asked him, thought this study from China was too small to matter, but we'll move on. He doesn't seem high on this drug at all. I'm not really sure why, but he's the pro. Meanwhile, some good news.
Brian, he's a pro, and I respect him a lot, but a small study that shows statistical significance is a really important observation. If it takes me 30,000 patients to show a difference, is that better than showing a difference in 62 patients? If a small trial demonstrates statistically significant differences, you should respect it and at least pay attention to it.
Right.
I have more faith in hydroxychloroquine and azithromycin than I ever had. And this is my own. I'm not the doctor. I am just reading. I'm telling you what I hear.